Good day, everyone. So this is going to be an acid-based Q&A questions. Question number 1. The nurse reviews the arterial blood gas results of a client and notes the following: pH level of 7.45, PaCO2 of 30 inches of mercury, and HCO3 of 20 milliequivalents per liter. The nurse analyzes these results as indicating which condition: A. Metabolic acidosis compensated, B. Respiratory alkalosis compensated, C. Metabolic alkalosis uncompensated, or D. Respiratory acidosis uncompensated. Answer is B. Respiratory alkalosis compensated. Question number 2. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client for manifestations of which disorder that the client is at risk for: A. Metabolic acidosis, B. Metabolic alkalosis, C. Respiratory acidosis, or D. Respiratory alkalosis. Answer is B. Metabolic alkalosis. Number 3. A client with a 3-day history of nausea and vomiting and suspected gastroenteritis presents to the emergency department. The client is hypoventilating and has a respiratory rate of 10 breaths per minute. The electrocardiogram ECG monitor displays tachycardia with a heart rate of 120 beats per minute. The ABG are drawn and the nurse review the results, expecting to note which finding: A. A decreased pH and an increased PaCO2. B. An increased pH and a decreased PaCO2. C. A decreased pH and a decreased HCO3. Or D. An increased pH and an increased HCO3. Answer is D. An increased pH and an increased HCO3. Question number 4. The nurse is caring for a client having respiratory distress related to an anxiety attack. Recent ABG values are pH 7.53, PaO2 72 inches of mercury, PaCO2 32 inches of mercury, and HCO3 28 milliequivalents per liter. Which conclusion would the nurse make? A. The client has acidotic blood. B. The client is probably overreacting. C. The client is fluid volume overloaded. Or D. The client is probably hyperventilating. The correct answer is D. The client is probably hyperventilating. Alright, our last question for part 1. The nurse is caring for a client with a diabetic ketoacidosis and documents that the client is experiencing acousmal respirations. Which patterns did the nurse observe? Select all that apply. A. Respirations that are shallow. B. Respirations that are increased in rate. C. Respirations that are abnormally slow. D. Respirations that are abnormally deep. Or E. Respirations that cease for several seconds. Correct answers are B and D. Respirations that are increased in rate and are abnormally deep.